Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Hello, good morning, everyone. Great to see you all, and thanks and welcome to this week's CATHIP session, so the Caribbean African Targeted Health Improvement Program. And this week, we're grateful to have Dr. Valentine Ngwa with us. But before we go to him, we just want to acknowledge the partners that have been working on this program. So Croydon BME Forum, Enfield Caribbean Association, Rafa International Development Agency based in Birmingham. And then we've got Royal House Chapel, RCCG in Sheffield, and then Black Health Initiative in Leeds. So we've worked on a collaborative basis to bring you this program Saturday after Saturday. And this morning and early afternoon, it will be on an interesting topic on positive aging. And Dr. Valentine will give us all the ingredients for positive aging and wellness. So welcome to you all. Just before we crack on, just so you will know, this is being live streamed onto YouTube and Facebook. And therefore, if you have friends, family members who may want to join but can't be on Zoom, then by all means share the link with them. And then also, because it's being live streamed, this will be available even after the session. So if there's something Doc says and you don't get it, you can go back to the video. And if you have any further questions, by all means, you can always email us health@cahn.org.uk and we will get back to you. Just before Christmas, we had a blood pressure monitor session, and we're going to announce, we've been announcing the winners, and I think this will be the last time. But if you joined, I think it was just before Christmas on the 17th, am I right? If you joined back then and your name on the device was Ernest, Krista, Claude, Beverly, Lawford, or Katie Rafain, then please do drop us an email, events@cahn.org.uk, or call our helpline 077-100-22382. And we will make sure we put the equipment in the post to you. So that's a couple of housekeeping rules. Just also to say, last week we did have some interruptions. So this week the team remains vigilant, and towards the end, there will be opportunities to ask questions in the chat box, as well as use the raise hand feature. So there will be opportunities, for that. So our topic for this morning and afternoon, or for this session, is positive aging and ingredients to wellness. And we're privileged to have Dr. Valentine Ngwa, who is one of the executive members of the Cameroonian Association of Medical Doctors here in the UK to present to us. So I'm going to hand over to Doc, and I'm sure it will be a fascinating discussion after his presentation. So over to you, Doc.
Thank you very much, and thank you for having me. I will share my screen if I may. Can you confirm if you can see my screen okay?
Yes, Doc, we can see your screen.
Thank you. Today I'll be talking about positive aging and wellness, and just a bit about me, so I'll give context what I'll be talking about. I work as a consultant physician in internal medicine and elderly care medicine in Mid Yorkshire Hospitals in Wakefield and Dewsbury. My initial primary medical training was in Nigeria, and I moved here in 2003, where I did basic specialist training in internal medicine in the Leeds area, and then I did high specialist training in elderly care and internal medicine in East Yorkshire training rotation. I also am a social gerontologist. I study social gerontology at postgraduate level, and that gives me an opportunity to see aging not just as from the biomedicine point of view, but also from the social and psychological point of view. And I do have a keen interest in researching aging, particularly aging in the African-Caribbean community. The reason I give context, because what I'll be talking about today will not just involve medicine and biomedical issues, but also involve social and psychological issues, because we age as a person, not as a disease or as a condition. So it's what we normally call the biopsychosocial element of aging. And that said, can I just roll on to give a little bit of snapshot of what aging is? It's different from old age. So most time when you say aging, people think it's old age. No, but we're aging from when we were born. The day you're 1 day old, you're going to be a day older the next day. So you're 2 days old. The reason why that is important to see it that way is because anything that afflicts that 1 day old child at that age could have significant ramification on how they live the rest of their life. Some childhood diseases can actually lead people to live life with the condition polio, for example. Some authors actually argue that you're aging from the day you were conceived, because if your mother does ingest some certain types of medications or drugs, it could affect the rest of your life. But for the purpose of this conversation, I want to differentiate between growth and aging. And I know there are different ways you can see age as either chronological, biological, mental. But let's assume the chronological age, which is the age where it's easy to measure. You're 25 today, the same day next year you're 26, so that's easier. And some authors will say you grow until you're 20 to 30, and then after that you start aging. Now, people who see it that way sometimes look at the negative side of aging, and they will say, well, you start going downhill, start losing muscle mass, you start losing some cells and stuff. But it could also be seen from the positive point of view. And that's what we need to do in this conversation. Why is it important to talk about aging? It is important because the older age generations in the UK is now becoming diverse. If you will go back many decades ago, you're quite sure that if you meet 10 people on the street, age 75 and above, at least 9 of them will be white people. But nowadays, you can guarantee you're going to see Black people, you're going to see Asian people, you're going to see people from all over the world. So it's now a diverse aging, but they're all coming with different ramifications. Their histories are different, the social circumstances are different, and how all this impact on how they live their lives is extremely very important. And I'm going to focus that on our community, on how all these ramifications do affect how we live our lives and how we could do that successfully or positively. A bit about the demography in the UK. As you can see, though we can, I mean, the one that I've circled red is the African Caribbeans and Black British population. We're still seeing people, most of our population are below 60 years old, but we're seeing people in the 70s and 80s as well who are having old age needs. And that old age needs have to be delivered in their particular specification. And those are the kind of things that we're not talking about. Now, the positive aging can be seen in different terminologies. It's the same thing. There are subtle differences, but I'm going to use all these terminologies: successful aging, productive aging, robust aging, aging well. That's what the NHS likes to call it, or healthy aging. I will use all of them interchangeably, and wherever there is a subtle difference, I'll point that out as we move on. So why is it important? The UK is one of the aging society, particularly Europe is an aging society. So this has been brought about by the fact that there's increased life expectancy in the Western world. That is thanks to the medical innovations, the delivering of better care, but most importantly, the provision of vaccines and clean environments and preventive measures. And there's also decreased birth rate, so we're getting people aging more in society. The median age in the EU, most Western Europe, is about 47 to 49 years old. In Cameroon, where I'm from, the median age is 19 years old, so that's more of a younger population and stuff. That has ramifications on how people age, because we are going to have less younger people looking after people who are a bit older. However, though there's an increase in life expectancy, there's also many people living in illness and disability. And by disability, I mean one or two defects in the activities of daily living. And these activities are things like cooking, cleaning, shopping, dressing, grooming, having a bath. When people can have one or two, inability to do one or two of them, we say they live with a disability, not impairment, disability. And also poor health is impacting people's ability to work. You can see highest in the Asian men, 43% of them are unable to work because of a poor health. So as we age, health and wellness is extremely important. This graph just shows to buttress what I've been talking about. If we go down to the bottom, the female's life expectancy is about, in the UK, is about 82, 83, thereabout. But you can see the pale blue line that living without any disability or illness, you got about 62 years, which means, therefore, that people are going to live the last, say, 18 years of their life to 20 years of their life with ill health and disability, which has significant ramifications for how they live and how they access services. So while life expectancy has increased, life expectancy without disability or illness hasn't increased that much. And in some cases, after COVID, is actually falling. Now, the biggest risk factor to picking up disease is getting old. There are many diseases we didn't get decades ago because people were not living that long, so they didn't get a lot of dementias and stuff. But once you're getting old, that's the biggest risk factor. However, if that risk factor is now coupled with other vulnerabilities, you're going to now pick up those diseases as you go older. What I'm saying, therefore, is if you keep everybody to age and don't get them to die, they're going to pick up all these diseases at some point. Some will pick up diabetes at 40, somebody else will pick up diabetes at 100, some will pick up at 120, because the hallmark of rapid aging is a condition called inflammation. Now, inflammation is supposed to be a protective mechanism in our body, where if we have any injury or any infection, our body can come in there with that inflammation, deal with it, and then it goes down, and that's fine. But when it is bad, it's when that inflammation becomes sustained and persistent. And as you can see from the various things I'm going to discuss, all what they do is ramp on that inflammation persistently in our body and makes us to pick up some of these comorbidities earlier. The earlier you pick it is now called accelerated aging, and that's something which we need to talk about because we have to age positively and not pick up any of these comorbidities. So therefore, what is successful aging? It's the social gerontological concept that came up in the 60s, and to say you're aging successfully if you meet all three of these components. One, you have a low probability of diseases and disease-related disability. Now, remember I said disability is the inability to do two or more of activities of daily living. And two, you have high cognitive and physical functioning capacity. That means your thinking is okay, you're not confused, your memory is not an issue, and you can walk around and do the things you want to do. And three, and most importantly, you can actively engage with life. So you can go to church easily, you go to your community meeting easily, you can meet up with friends and go to restaurants, you can do the things that you like to do, party, dance, and stuff. If you're meeting all those three, then you're set to be aging successfully. Now, when you say risk factor reduction, what do they mean? Remember, I didn't say inability to have, not having any disease, but having a low risk of having those diseases. And what are they? The normal triad for older people to get a three-component triad is a cardiometabolic syndrome, so hypertension, diabetes, strokes, a pain syndrome, so arthritis, rheumatoid arthritis, osteoarthritis, and a mental health syndrome, depression, the dementia, occasionally the delirium. But also, as we get older, cancers are becoming an issue, and the causes of it are changing due to our changing lifestyle as well. And one thing we shouldn't forget is the infection. So we'll try and talk about how we reduce these issues, which have significant connotations onto our health as we age. The first is, how do we reduce the probability of disease? How do we put ourselves at low risk? We cannot start this without talking about diet. And I know CATHIP has had a webinar on diet before, and it's going to take certainly a whole lot of time to talk about everything. I'll always point people to go back and look at that video, because a lot of important concepts were brought out. But just as a summary here to say, there's something called the dietary inflammatory index, which tends to rank food by how easy they are to cause inflammation. Remember, I said persistent inflammation is a no-no if you want to age successfully. And the foods that are topping rank up in that dietary inflammatory index are things like processed meats, animal products, refined carbohydrates. And that is important because many of our diets from Africa carry refined carbohydrates. You know, I mean, Cameroon would like to eat corn made in fufu. And there was a study that was done in London, particularly among Ghanaians, trying to find out what interests them in the food they eat. Is it because of its health benefits or because of its taste? And taste was the first thing that came on. So we really need to engage in this in our conversation. And I would say, and as I've said, I'll encourage people to go and have a look at that webinar. Bottom on the list on the dietary inflammatory index are things like green leafy vegetables. Now, exercise is another part that we need to engage, both aerobic and resistant exercise. And as you see, we're going to see in the next slide, you don't have to be in a structured, enclosed environment. It can be done anywhere else. Weight management is another thing that we need to be taken into account if we need to age positively. But I must warn people who are above a certain age, if they need to do that, then they need to actually employ the help of experts. Because if you have to lose weight after a certain age, there's a high chance that you might be losing more muscles than fat, and you might be losing more bone as well. And when you lose muscle, you develop muscle weakness, which is sarcopenia, which is how frailty manifests in the muscles. And when you lose bones, you could be going down the route of osteoporosis and osteopenia, which makes it easier for you to fracture. Now, a fractured hip, which it could be a very significant thing in somebody's life, makes your chance of dying in 30 days to be about 10%. And in the UK, 1/3 or a quarter of people who fracture their hip could be either severely ill or dead in a year. So it's something to seek the opinion of experts. We will emphasize special care of the feet. That's what actually carries you up and about, and walking is a fantastic way of exercising, and of course your eye and your mouth. Well, I want to emphasize on mouth because that's something which many people underestimate the effect of which it can make you quite ill. Some people will know that when they go to the dentist because of their various conditions, before the dentist does an extraction, they give them antibiotics for a while. And that's because some bacteria can go through your mouth and actually make you become very, very, very sick. Smoking cessation cannot be overemphasized, not just for the fact that it has high chance of causing cancers, but also for the fact that it has chance of causing clotting in your blood vessels, and also for damaging your skin. And alcohol reduction, the limit is 14 units for women in a week and 21 for men. And if you can do lower than that, actually, alcohol has been linked to a significant reduction in the size of the brain due to losing brain cells, and has also been linked to various cancers, particularly cancers in your throat and gullet. As I said before, exercise doesn't have to be in an enclosed, structured environment. And this is from the Aging Well website in the NHS in the UK, which states that brisk walking, dancing, climbing stairs could be markers of aerobic exercise, which is good for the cardio metabolism. And also resistance training could just be carrying groceries from the shop, gardening, digging the garden. I put dancing in red because our culture does emphasize dancing a lot. We dance at almost every occasion. I mean, even if you go to our churches, praising is serious dancing, and you can go to church and actually do some serious exercise, and that's something that will thrive in. So getting up in the morning and having a bit of a dance around the house could be just a way of achieving your 30 minutes of the type of exercise that gets you to pant, which is good not just for your aerobic but also for resistance training. Now, I brought in this slide because I want to actually emphasize what exercise does to the brain. Now, it's quite an important aspect of the brain. Now, if you look at the diagram that you're seeing there, it is the brain. You can imagine you strike your head in the middle, and that's one part. Now, the brain as an organ, various different parts of the brain need different amount of blood supply for its nutrient. Some need more, some don't need that more. And the places that need, the parts of the brain that need more are the parts that are actually very super active through the day. Now, if you look at the blue one at the front, is what they call the prefrontal cortex. It's very important for executive functions. All those things that you do to be efficient, to do tasks quite well, to manage finances, to plan, prioritize things, they're quite important. And because they're important for daily living and survival, it is an important part that needs a lot of blood supply. Also, the little part down here is called the hippocampus. This part is important for memory. So when you form short-term memory, you have to make it to long-term memory. It goes through the hippocampus. As we age, because these parts are the ones that are needing a lot blood supply, and as we age, the blood supply that goes to the brain gets narrowed down because the blood vessels are getting thickened. These parts are the ones that suffer the loss of cells first. And that's the more reason why people who are getting in their mid-50s start having memory issues. It starts by what they call tip of the tongue phenomenon, where you know something, you might see a friend and you know the name, but it's just there, but you can't get it. And if that progresses, even in normal aging, memory is an issue. And you always hear people in their 60s and 70s say to you, well, my memory is not as good as it used to be. But exercise has been known and shown to actually reduce how these areas decline, because it's assumed that about 1 to 2% loss per year. But with exercise, and of course, adequate nutrition and good well-being has been known to actually reduce how these areas decline. And research is actually showing that you could actually be more cells in those places when you're given the right conditions. Now, this hippocampus is good not just for the memory, because the memory can be spatial. So if you leave your house and you're going to work, for example, you know the direction because you've known it for quite years. But if you lose your hippocampus, then you might get out on the street and don't know where to go, don't know where you are. And sometimes you see some older people who have lived in a particular house for decades and decades who come out and have no clue where they are. Or you can see people cannot even remember the names of the people that they've known for quite a long time, is partly because of a decline in this area. Now, this colleague, Dr. Koshowe, did a work in Scotland, which was a qualitative work looking at people from the Black community and also other minority ethnic communities to say, but we know all these advantages of exercise, why don't we do that? And there are 5 themes that came out that I'm quite interested in. The first is there are some cultural restrictions, in the sense that some cultures grow up and people at a certain age don't see themselves as going either to a gym or going to a park and do some exercises or going out jogging on the streets, because it is not in their culture. And some don't even see an ability to go in gyms, and particularly females, for religious reasons, to mix with men who are half-dressed. They find that an abhorrent behavior for religious reasons. And people living in a particular area, people could have a perceived discrimination to go into the community where there are predominantly people out of their culture to do exercise. And of course, there are personal reasons. So people are quite engaged in work. I mean, where economy is in downturn, so people can do 2 jobs and don't have the time to engage in exercise, or they could be involved in more social activities in their communities and not have that time. But it just could be that they lack the social network. It's best done in a group and the community or with friends. And so these are some of the reasons that they've found, and I'm sure in our various communities when we are making decisions and plans how to support each other, we should look at all these factors and see how we can mitigate them. Now, let's talk about infectious diseases. Now, as we age, our ability to fight infections get diminished. Is because of a process called immunosenescence, which is a mouthful, but it just means that our immune system are becoming weaker and tired. And so the ability to mount a defense against offending organisms are less. And that's the more reason why vaccinations are encouraged over a certain age. And so people at a certain age will know that they get these letters from their GPs to come for their flu vaccines every year. And also people who have long-term conditions, even if they're not that age, get this invitation, because those long-term conditions means that you're actually aging faster, and you might be at a biological age higher than what your chronological age is. And the flu vaccine is one of them. Now, above 65, we tend to give the pneumonia vaccine as well. The reason being, there is an organism called strep pneumonia, which has significant infections in people above those age, and there are various reasons why. The COVID vaccine as well is something which we're giving based on people's ages, because your ability to mount defense is as weaker as your age, like I said before. Now, shingles vaccine is given in the 70s. Shingles is a condition which arises from the virus that causes chickenpox that has laid dormant for many years. Most of us will have chickenpox when we were kids, but the virus never goes away. It just stays dormant in your body. And when the condition arises, either be to weaken immune system or another disease condition, it reactivates and comes as shingles. It can be a very debilitating condition because it can leave you with body scars that can quite be painful, called post-herpetic neuralgia. And people tend to suffer pains for many, many years. There are also many travel vaccines which were advised to take, depending on where we're going to. I mean, going to Africa, you definitely need to have the yellow fever vaccine as a requirement, and there are other ones as well. I'm sure a travel center will advise, depending on the region you are traveling to. At a certain age is important, as I said, because your immune system will not mount enough defense if you come across those organisms. Now, I would not finish infections without saying a word or two about sexually transmitted diseases. As we're seeing, and as the infectious disease specialist will be telling you, we're seeing more and more people above 65 having sexually transmitted diseases in England. Now, this is not particular to our community, I must quickly say, but nevertheless, it's increasing, and there are many reasons why. with the increased rate of divorce or bereavement, people are now being free to negotiate new relationships, and sometimes new multiple relationships. And also people are now having medications at their beck and call that could enhance their prowess. With availability of increased travel, increased low-cost travel, and all-inclusive travels, many people can be a bit more exploitative. And unfortunately, that age, the age above 65, is not the age where you traditionally will give them safe-sex message. I'm sure if you go into your GP surgery, you wouldn't really get people giving those messages at those age, which is something we need to have a rethink, because that puts this age group as increased vulnerability, and they will not be able to negotiate safe sex. I thought I'd put this in there so we don't miss the fact that everybody needs to know that message, because an infection there could also make you live not so positively. Now let's go back to cognitive. Let's go now move to cognitive function, the ability to have a good memory and think appropriately. There are ways you can predict that the functions will stay. And the first and the most important is education. I must quickly say here that I'm not just talking about formal education. It could be also informal education, but any endeavor to increase the knowledge capacity. I will not emphasize exercise because I've said that before in the previous, but just to quickly say that exercise has also been shown as something to mitigate depression and also as a curative strategy for depression. When combined with some antidepressants, it seems to work synergistically, which means it works together. And being very self-efficient, being able to do things appropriately in timely manner, being very orderly are also things that can mitigate against a cognitive decline. Just to touch back on education, it has been shown to be effective in two ways: directly, amount of years that you can spend schooling, either formally or informally, but indirectly, because when you're schooled, you have the opportunity of engaging yourself in intellectual activities, reading books, novels, papers, doing puzzles, Sukudo, and whatever. I can't remember the other one, but those things that people do that are little puzzles. However, when we put successful aging in such a tight knit, we ignore certain things which are also important as people age. And in our community, I want to bring out three of them. One, the process of migration, successful aging or positive aging in the literature, which has been based solely on the Western neoliberal community, ignores the fact that other communities also go through other things which has ramifications for their aging. The first is migration for us. Quite a few of us will migrate into the Western world in our adulthood, and that has significance how we settle down, how we adapt, and how we age. The experience of discrimination is also important how we age. This goes straight to my heart because it is one of the very strong social determinants of aging. It's something which you wouldn't read in mainstream literature because it's not been studied clearly in our community. But I'm glad to note that more and more people are talking about the effect of this, not just on our health, but our communities at large. And of course, the socio-economic situation of the individual has significant ramifications how they age. We do know, COVID did show to us that the people in the low socio-economic strata of society suffered significantly from the effects of COVID, both directly and indirectly. But what do Black people themselves say? Now, Dr. Ward did a work down in southeast of England. It was a qualitative work, so we talked to our community. We were mostly talking to people from the Caribbean community and saying, what does healthy aging means to you? And people giving us that subjective opinion about it. For them, it means maintaining independence, engaging in life, doing the things that you love to do, volunteering, having a sense of purpose and identity, Having a social network, those people, friends and family that you can trust when things don't go right, they'll be there for you. Being a carer, either to grandchildren or to other relatives, even older relatives. And the last time I gave this talk, I emphasized on optimism as a strategy to live successfully. That ability to believe that things are going to be okay. It has been shown to actually increase people's life expectancy, significantly so when they have life-limiting diseases. And I will not say this without emphasizing spirituality. And we had a talk on spirituality and mental health, spirituality and well-being. And I remember the Reverend from Birmingham said, we are a spiritual people, which I think we are. Our spirituality has been linked to successful positive aging. But also, there's a lot of there's a lot of literature, particularly coming from the Black Americans, who are saying overcoming adversity is another way of aging positively. And those adversities are poverty, exclusion, discrimination, as I've said before, social isolation, and poor health. I mean, I think COVID did uncover all of this, so I can't emphasize this enough. Now, I will take a few minutes to talk about what the females, particularly across the pond in America, are saying, what successful aging means to them. It's about developing the archetype they call the strong Black women archetype. And that is very important. That tendency to be self-reliant, selfless, to have strength both in psychological, emotional, and physical well-being, and to be able to face society. We know, I'm sure we all will know the history that we've come from and how people have fought to find the place at the table. More so, Black women have been able to do that. And why is that? Because they face what they call intersectionality. They're facing discrimination not just because of their race, but also because of their sex, what they call gender racism. And this is a tribute that have been given by Black women by two heroes of mine, or to be politically correct, say Shiro and Hero. And those who remember Trevor Noah, when he was leaving his show in America, did give a tribute to Black women. He said, if you truly want to know what to do or how to do it, or maybe the right way or the most equitable way, talk to Black women. The reason he said that, and as he went ahead to say, was because they know when things go wrong, it goes very bad for them, because they've been there before. They'll not only be facing things go wrong because of their gender, but also because of their race, and that's the intersectionality. But we need to take a little step back sometimes and think, because though we say our women say, I want to be the strong Black women archetype, because they believe in the fact that adversities you experience will be a stimulus to your resilience. And I'm sure I mentioned this in my last talk. In some people, those adversities could actually desensitize them and cause problems or physical and mental health issues. They could, because when you feel that, well, I'm strong, I can take everything that comes my way, they could just be a way you're hiding that appearance behind you, denying the pain and suffering and emotion that you're going through, which are all harbingers of depression and also inability to use resources. I listened to Michelle Obama speak a few months ago. I know when she was in the presidency, she used to always say, when they go low, we go high. And a few months ago, when she said, when they go low, we go high, she quantified it and said, but it's very hard. And is that recognition of the fact that sometimes sitting in the presence of adversity and proving a face like I can deal with it could also be a detriment. And studies done have been shown that continuous stress leading to the release of stress hormones has had significant impact on the physical and mental health of not just Black people, but minorities all over the world. It's something we need to always recognize in our community. Now, do we now say that people would not be living positively if they don't have those three components we talked about? Low probability of diseases, good physical and mental health, and enjoying life? Because life happens. This study was done in England looking at people above 18 years old who are registered with some GP practices. and 27% of them had more than one condition. And we'll talk about diabetes, hypertension, pains, anxiety, chronic pain, and stuff like that. But when it gets up to 50 years, more than 50% of them are having conditions. And also, more females are having those conditions than males. You see, this is one thing in society, we know that females live longer than men. Life expectancy for females in England is about 82, men is about 79. But unfortunately, females also live more of those lives with more diseases and disabilities than men, which is kind of a paradox. And we also know that those diseases are more prevalent in low socioeconomic classes and are higher in any minority group, including Black communities. With the NHS and the social care struggling at the moment, and with this people needing more visits to their GPs on social health, you can imagine what the health is today. But no, you can still age positively with many different comorbidities, and that is by having a positive adaptation. And there are various ways you can do that. The first is by doing what you call assimilation, where you try to adjust your goals depending on the restrictions that you've got. Or you can do that by accommodation, by actually getting new goals. So if your goal was to run down the hill, which is around you, but you now got injury to your knee or to your ankle, and it's now been fused and you can't go up and down the hill, you can change those goals to running on a treadmill somewhere else. Or if your job was to walk on to walk, and you can't do that because things have changed in that road and it's now unsafe, you can change those goals and probably run in the park, which will be safer. But there's another concept called selection, optimization, and compensation, which is just a fancy way of saying you could now pick up the things that you want, involve in putting resources in there and make it as best for you. Most importantly, and without emphasizing this, and I'm sure your fellow GPs will keep a tabs on this, if you pick up comorbidities or many diseases, you need to follow chronic disease management. The NHS seems to have, I think it does still have a fantastic way of keeping tabs and making sure those diseases are managed appropriately. So I'm saying, therefore, that successful aging as a paradigm, when it meets adversity, and of course, Black people in the UK have adversity on a daily basis, you can therefore live a productive age by being a resilient person. So we'll not talk about resilient aging because you're going to face adversity. I remember the last time I gave a talk on CATHIP, and a lady in the audience did say, and now it always stayed with me when she said, I came here many years ago, racism don't seem to have changed. I said, oh, actually, it's true. I remember my response then was, because we are thinking that it is a Black problem. It's not, it's a white problem. And when I was reading further in Dr. Bruce's work that she's done, and she talked about the aspect of coloniality of power, because racism rests on the aspect of power. And I've never seen anywhere in the world where anybody gives away power voluntarily. It has to be a fight. So resilient aging would happen by us building assets, and we can do that at a physical. So, and before I say this, I must need to emphasize that it is a life course approach. It doesn't have to be that until I get a certain age that I now start building these assets. The more reserves you build, the more you will have to use when that time comes. And people have been known to have a massive heart attack, but the reason why their heart survived and they didn't die was because they had been training significantly, and the blood vessels in their heart have the four called collaterals. The little ones have been able to open up. So when the major one blocked off, the little blood flow around it could actually supply those muscles and limit the damage that it caused. But if that were not the case, they would have certainly not. So building reserve, not just physical reserve, mental reserve, financial reserve as you go older, is to say that when those risks come, and they're going to come because this is life, when they come, you would have some reserve to fall back on. It's just like keeping money in a bank. One day your car's going to break down. You can call out the mechanic and pay, but if you have no money in your account, we won't be able to do that. And we build that both physically, psychologically, but most importantly, strengthening, engaging your immediate surroundings and your community. And that's why what CATHIP is doing is fantastic, strengthening our community to be able to deal with shock, as I said before, spirituality, because the risk of life will be there. You can get up in the morning, get a 10K run, come back, have a shower, go to work, and as you enter into your workplace, somebody says something derogatory and racist to you. And if you haven't got that resilience to deal with it, that is the spoil of your day. You can deal with that by being individually training yourself, and I'm hope we're going to have a training session on this, or if we've not had yet, building your family as a support structure, your neighborhood, your community, and of course your society. So that said, let me summarize by saying, therefore, that positive aging should actually be resilient aging. The ability to do the good thing, both physically, mentally, socially, but also be prepared for adversity and deal with them. Because you're resilient when you don't fall down on adversity. And even if you do fall down, you get back up. Aging will always present a vulnerability as we go older. We're always going to meet things, either we're going to have friends or family pass away, we're going to have spouses pass away, we're going to have close friends move away to be with family some other place, we're going to have some illness or accidents, and how we deal with them is how we're aging resiliently. And as I said, we do that by building assets, so when those things occur, we can still manage. Now, the study that I did quote, our people have a subjective meaning of successful aging to them. That has to be balanced with the objective meaning as well, because it doesn't just matter on what you think. If what you think is not what has been proven to be, when those shocks appear, you easily be swept away. We saw that with COVID. We saw how much the Black community did suffer from the effects of COVID. It's time for us to think that way. We're actually objectively being resilient, or do we think we were when we were not? So objective measures of being resilient, both in physical, mental, psychological, is quite important as we move. And I'm glad to note that in some states in America now, they're making racism as a public health issue, as it should be. Because it has been shown that sustained racism is as dangerous as smoking 20 cigarettes for life. It has significant connotation for the prolonged stress and ill health in people who are suffering it. And let's not forget, resilient aging is a journey. We're always moving. Even as resilient as you are, you need to keep moving. If you can run, walk, if you can walk, crawl, or whatever we do, we need to keep moving. I want to end there by making acknowledgement to some beautiful authors. Have been blessed to read their works on the Black community in the UK. And the beauty about this were qualitative works. So I've got the voice of the Black people themselves. I've been quite enriched and blessed by them. I'd like to thank Dr. Fred Bruce, who did a work on decolonizing health inequalities, working on the African Caribbean community in Greater Manchester. I want to thank Dr. Daniel Ward, who did resistance and resilience work with the Caribbean community in Southeast England, and Dr. Keshodo, who did work on physical activity among the Blacks and minority ethnic groups in Scotland. And of course, I've used the work from the NHS and the work that I do as well. But it's been an honor to be here, and I want to thank CATHIP for inviting me back, and thank the audience for your kind attention. Thank you.
Thank you very much, Dr. Valentine Ngwa, for that insightful presentation. Really, really interesting. And, lots of perspectives to this as well, whether in the US or, some of the people within our community that have done excellent pieces, including CAHN's own, chair, Dr. Faye Bruce. So, Doc, I know, colleagues on the call have many questions, and we will be going through that. But then I wonder, what your suggestions will be, because one phrase you've used that I like so much is "as life happens," and whether we like it or not, events and incidents and things will happen. Some of it within our control, others outside our power. So I wonder what suggestions you can give to us. I know many of us on the call, we may not necessarily have been at that age yet, and we are approaching, but we may have family members that we're looking at. What tips could you give us with regards to improving memory, and whether there's anything we can do for some of us who are still young, as we prepare for resilient, positive aging?
Yes. The good thing about it is the thing that you do for memory will be the same thing you will do for cardiovascular. So they're all working in synergy. They're all working together. It's first and foremost, your nutrition is very important. A healthy lifestyle is very important in terms of exercise and smoking cessation, alcohol. Alcohol is a very big issue in losing neurons in the brains. And when we do scans for older people, normally it always says there's atrophy in the brain, which means there's shrinking of the brain in keeping with the patient's age. But those who've been drinking alcohol, you would see that shrinking has been significantly more. So it's very important. Now, sustained stress is something which you really need to work on, and that's why I'm so passionate about things like discrimination and racism, because those are markers of sustained stress. Other health tips like good sleep. There's been work that's been done showing that all the cells in our body has what they call a circadian rhythm, which means that there are some times when they need to rest. They're not for something else. So if you're doing the wrong things or the right thing at the wrong time, or the wrong thing at the wrong time, then you're actually putting yourself through another stress. That has been shown that people who do night shift, for example, suffer health consequences, diabetes, and strokes higher than people who don't. So just to conclude, the nutrition, the exercises, reducing sustained stress, unhealthy habits, alcohol, cigarettes, getting good sleep, and having good relationship, and of course, exercising your brain in doing things like reading, brain tasking jobs, crossword puzzles. They're all things that have been shown to help, and of course, reducing your disease as well, because some people call dementia now, they call it type 2 diabetes, isn't it? Because it's also linked to the same kind of pathway with diabetes. I hope that answered your question.
Yeah, thanks, Doc, for that. I like the fact that you said things are interlinked. Last week, for those who were not with us, we looked at, a blueprint for a good night's sleep and the importance of it, and Doc has touched on it. And time again, you've highlighted stress, and next week we're going to look at dealing with panic attacks and anxiety disorders, all within the mental health spectrum. So please make sure you do join us. And also, I think one of our winners for the blood pressure monitor has dropped an email in there. You've dropped a message in the chat box. Please drop us an email, and the team will liaise with you and make sure you receive your equipment. Brilliant. So a couple of more questions in the chat, and some have come privately. So I'm going to give you, Doc, another question whilst I wait for many more to come. And then please, we know not everybody can type in the chat box. So if you'd rather ask your question verbally, then please use the raise hand feature. So someone has sent over a message: as I get older, and I'm 60 now, I'm finding it quite common to lose my appetite. I also find I have difficulty sleeping, even though I'm still working for a good amount of hours. But usually the average sleep is 4 hours per night. Any advice for me?
Yes. First, I must say it's it's difficult to give us advice straight on from that, but I must emphasize that getting sleep hygiene is something which is extremely very important. What you do just before you go to bed is extremely important on how you get a good night's sleep. But despite so for example, don't eat before you go to bed, how you relax yourself, how your room is configured for you to get good night's sleep, how some people tend to keep things like radio and TV in their rooms, how your bed is for a comfortable sleep. But even for some people, even doing all those things still needs that they have a specialist assessment for their sleeps, because it might be a lot of other things as well. What we don't realize is that sometimes that a lot of almost 90% of what happens to us is in our subconscious mind. And so when somebody is going through certain things in their life and not aware of how much it's affecting them, when you're all rested, it's when it comes to the forefront that might be impacting to sleep. Again, it's difficult to answer the exact question on this particular person who asked this, but there are ways of getting a good sleep hygiene. And that is avoiding food before dinner, avoiding what you eat or drink before dinner, alcohol, caffeine, before bed, alcohol, caffeine, and how your room is configured and your thought process. But I guess if that still is an issue, then it will be worthwhile seeking some professional help. So a lot more history could be taken and possibly some tests as well. I must say there are laboratories for sleep studies. So which means that some people, after all this, they maybe have to go somewhere where their sleep is they're being monitored as a sleep and they're being tested and they can come out with the exact reason.
Thanks very much, Doc. A lot of positive comments and appreciative messages in the chat box about how enriching the talk has been, insightful and all. Right. Doc, you did make a reference to the resilient, strong Black woman. And I wonder whether you can unpack that a bit more. And on the one hand, there have been times when people feel because Black women are perceived to be strong and resilient, then sometimes they don't get the due care, that they require. And therefore that leads them aging, a lot older than their actual age. And I wonder how we could balance that out.
Yes, I think this is a very important concept that our community should take into consideration. It's historically, or women have been quite important in how families are raised, how we're raised in the family, and sometimes we just assume that they know what to do, and because they're dealing with it, then they're fine. But a lot of it also could be that they're bottling some distress. And because they know that there's a job that needs to be done and they're doing it, they might be doing it at significant harm to themselves. I think it is for all of us, for society to recognize that though somebody doesn't complain to you, doesn't mean that something is not going wrong. But it does selflessness, which we see in our mothers, to put themselves back and do things for others, which is what we need to appreciate and recognize. But more so recognize the fact that that could be done at a significant harm to their own bodies as well. And now this has come up a lot from the studies across the Americans, because of course through all the struggles, Black women have always stood at the forefront, either supporting the men who are going out and being killed unnecessarily, and then having to deal with raising the families, or the men who are being incarcerated and have to deal with the family. And when they have to deal with the family, they have to put their chin up, suck it up, and carry on with it. But that has been shown to have significant consequences as well on them.
Okay, thanks for that, Doc. I think earlier on you did refer to the impact of people's situations and where they live and how that impacts on their life. And we know, our community here in the UK and sometimes the number of jobs, people have to do And so I just wanted to find out in terms of how we look after ourselves, as people age, but then also when people come to retirement, any tips for staying active, healthy, so that they keep on trend, for that positive aging.
Yeah, I think there's actually some saying that, excuse me, saying that the more you're getting older, the more active you should be. As we know, when you were younger, see the energy that you get, you can burn them to various means. The way your body mechanism burns those energy called the better metabolic rate. As you're getting older, that drops, which means therefore that if you're not burning those on other activities and you're still keeping that involved, that up, then you're suffering from the effect of over-calorie intake. And we know that that has got significant consequences on your longevity as well. Now, exercise, walking or doing just normal things that you enjoy to do, gardening and stuff like that, no matter what stage you are on, is still very important when you live active work. And some people who have retired from active work and done what they think retirement is all about going to rest, has been shown not to have lived much longer. But being more active after retirement is helping that to live much longer as well.
Great. Thanks for that, Doc. You did also refer to spirituality in your presentation, and I wondered whether you can expand on that a bit more, because I'm sure there are different traditions. There will be people who do not have any belief at all, but what we know and what we see from the work we do is sometimes people of a particular faith will, especially in old age or as they age or retire, have lots more opportunities to be part of the wider community, give back, volunteer their time. And obviously, like you've just mentioned, that is really, important for keeping well and active. So I wonder whether you could touch on that a bit more.
Yes, I think like we discussed the last webinar with one of our colleagues to present, spirituality has got to do with has a lot to do with your mental health, but more importantly, how you discover who you are, because knowing who you are is a very important concept in how you navigate the intricacies of life. If you don't know who you are in life, definitely people can tell you who you are. And one of the things that you don't want some society, particular society with a lot of coloniality, is to be defined by other people. And you want to define by yourself. Feeling that inner self-confidence, in my thought, and again, that's what the literature is showing, having that inner self-confidence of who you are is actually a strong way of how you navigate yourself through life. I'll give you an example. You could say one thing for people who are in a professional environment, that you could say one thing and you could see it as I'm being assertive. But the same thing could be seen by another person and called you're bullying. So it's how you define and assert yourself. And these are the kind of things that spirituality makes you do, because it makes you define who you are, know who you are. And also having the belief in a higher being has been shown in the social deontological world to be important in how people not only acquire optimism to say it's going to be okay, but also navigate through life. For example, though we're not saying people should have a false belief to say, well, yeah, I've got this tumor in my brain and God is going to take it away. But all what we're saying is having that optimism that life is going to be better has been shown in a lot of studies to lead to people living much longer. And there's no way you get the optimism far more than when you discover who your spiritual side is.
Great. Thanks for that, Doc. Someone is posted in the chat box, feeling contentment, can also help people relax and sleep peacefully. And I'm sure next week, when we do the session on staying calm, dealing with panic attacks and anxiety disorders, I'm sure Dr. Joseph will touch on that a bit more. Doc, we also know, as we age, especially because of our skin, whether in this part of the world or sometimes even, you know, in our home country, in the Africas and the Caribbeans, you know, we see changes. And I wonder any, you know, tips you have. So how do we ensure that as we age, we also looking after our skin and protecting our skin?
Yes, there are something that we can do that does help, and I think I did touch on smoking has got significant impact on our skin, and alcohol. Overexposure to sun without adequate sun protection has also been shown. So, for example, if you go back to places where there are lots of high level of sun and people are not using sunscreen, and you compare those who are using and those who are not using, you will notice the difference. It tends to age you more with a lot of ultraviolet radiation from the sun. And of course, there are a lot of skincare products. I'm not a fan, and I can't really say much about them. I'm not an expert in that, but I know that the subtle things, like as I mentioned before, healthy lifestyle, nutrition, diet, smoking cessation, alcohol, good rest, and those are the little things that you could do and get your skin healthier. And I'm sure the dermatologists in our midst could be able to feed more on that. I can say this just from my rudimentary knowledge on aging, but I'm sure those who are the experts in skincare could also say more to that. But also what we use on our skin is also quite important, and I'm sure many of the cream that we use on our skin could age us faster. But I'm sure I'll leave that to the dermatologist to share more light on that.
Okay, good. Thanks for that, Doc. Whilst you were talking about that in skin, someone has sent a private message. Is it okay to have shower with lots of hot water? Yeah.
Yeah, I'll honestly leave that one now to our dermatologist too. I can't claim expertise on that front, I'm afraid. So I'm sure the dermatologist of our midst will be able to answer that one better.
Okay, thanks, Doc. Doc, the other thing I wanted to check, especially for those who live, because we have people listening from, you know, around the world and on different continents, especially for those in the UK, but also those listening from different countries. In terms of positive resilient aging, how would you suggest people engage with their GP or with a doctor? Would you recommend an annual health check? You know, yes, obviously in this part of the UK, people have opportunities for various screening programs, and they get letters through the post. Could you touch on that and how that really contributes to overall resilient aging?
Yes, absolutely. I'm sorry I didn't talk about that in my talk because I just assumed that we're in the UK and there's an NHS structured program called the Aging Well program, which insists on certain screening. You know, when you reach 40, you have the 40 screening, and if they pick up any abnormality, they give you a structured program to follow you up and make sure that you're having adequate disease management and stuff. But if somebody is in a part of the world where all these structured national health programs are not available, after the age of at least 40, you should be having regular checks. And then the UK will have regular checks for the kidneys, for the liver, the diabetes. At a certain time, your prostate, and you do a screen for colon cancer and stuff like that. Those are all embedded into the program that is rolled out. But if somebody who is not in the UK and the US as well, if you got insurance in the US, you got all those things, and most places of Europe. But if you're not there, then you really need to be making yourself available to having those screenings. Because if they're caught earlier, they can be dealt with. For example, if you catch your prostate cancer earlier, which I must say is higher prevalence in Black people, then it can be dealt with easier than when it's caught, when it's spread. The same thing with bowel cancer as well. So if the screening programs are not there, then you need to meet your doctor and roll out a screening plan for yourself. One of the things in which we're not very good at particularly when we're out of here is to engage ourselves in preventing programs, in prevention. The reason why it is easier in the UK because it's a government embedded program in the National Health Service. So you're getting all these letters of invitation to go there. I'm sure people will be getting text message about flu vaccines and COVID until they're inundated with it, because it's all enrolled in the program to make sure that people are meeting and the GPs are meeting those targets as well.
Thanks, Doc. You've hit on a very important point, because we know usually in the winter in this part of the world that healthcare system is under pressure and lots of challenges. But you've touched on flu, you've touched on COVID. I wonder what your message will be, especially for those 60 and above or 50 and above. What would your message and reassurance be? Because every now and then people hear different things. Oh, I had the flu jab and I ended up with the flu and it was really worse compared to, when I didn't take it. So I wonder what your, message and advice will be.
Yes, I'm quite also aware there's some controversies about vaccines and stuff, and of course vaccine, there's some risk factors as well. But the downside are nothing compared to the benefit. As I said, if there's one thing life expectancy has improved is thanks to vaccines, both childhood vaccines and stuff. This year, there's been massive amount of illness and deaths from flu, and I'm sure the vaccines would have reduced that mortality, that the people dying. Yeah, you get some side effects with it. Oh yeah, if I have the flu vaccine, I definitely tend to go down for a day. But I'm also aware of what happens when you have the serious flu as well. So while we do debate about the fact that there are some side effects of vaccines and there's some downside of vaccines, let us not forget to appreciate the beneficial side. It is massively beneficial to have the vaccine, particularly if you're vulnerable. And one thing COVID showed to us is that many people are vulnerable, but they were not aware they were vulnerable. They only knew they were vulnerable when they were at the height of their disease.
Great. Thanks for that, Doc. Someone has suggested meditation, yoga, as part of, improving well-being.
Yeah. Just to say quickly that has a lot of evidence as well. Yes, I must say yoga and meditation has a lot of evidence in well-being. Yes. Great.
Okay. So someone has posted a private message saying, she went to the GP asking for test and whether they could screen for kidney and liver, but the GP said no. So for such a person, what do you have to say to them?
Well, without knowing the exact circumstances and knowing how old the patient is, kidney disease is something which there's been a mandated for to people to have a screen. I know there is a program in the UK called the National Confidential Inquiry into Patient Outcome and Death, which every year looks at a particular condition. And I think in 2009 it looks at kidney disease, and it say many people are actually suffering the effect of kidney disease because they were not being picked up when they are attending hospital, and that made it important that when somebody approaches an acute hospital, no matter what the reason is, as long as they're getting admitted, you should at least do a kidney test because you can pick up the kidney failure from there. And I do also know that from age 40, when you go for the 40 check, you do get screened and the kidney test is done as well. So I'm not quite sure what the particular circumstances here was, whether the person was feeling unwell and wanted those tests done or not. But if you're feeling unwell, at the moment, we all know the healthcare is in crisis, and sometimes people might feel like they're being, they're not being treated fairly. You can always ask for a second opinion. You can always ask somewhere else, because having that thought at the back of their mind, we were taught when I was postgraduate training, that patients don't come to you just with their disease, they come to you with their thought. And one thing that you want to do is to clear that thought. So if one doctor doesn't seem to listen to you and clear that thought from your mind that there could be a kidney disease, then seek another second opinion as well.
Great, Doc. You've hit on a point, and I think a message from one of the listeners has just come right at the time you were saying seek second opinion. How can we practically do that? And I know, and we keep saying to all our listeners that, for you and your colleagues, and for those who didn't join right at the beginning, Dr. Valentine Ngwa is one of the executives for the Cameroonian Doctors Association here in the UK. And this morning and afternoon, many of his colleagues are on the call as well, who are medical professionals. And we keep saying all the time to our community, second opinion is available, whether you can afford private care or you drop us an email. And for all those who present on this, sessions, they will be happy to have conversations, because one listener has just posted, no matter what I go to the doctor for, the doctor keeps saying, oh, because you're older, without doing anything. For such a person, I know you don't have the full case, but what will your advice be?
Yeah, I must say we're living in difficult times at the moment with assessing health and healthcare because of the sheer numbers and sometimes. But as I said, if somebody has a condition that the thought at the back of your mind needs clarifying and you're not getting that clarification, then even if it means that you pitch up at the A&E and get some tests run, that's the way to go. I've got colleagues who have had conditions that they've been going to the primary care for about 6 months before it was finally uncovered. So it is not unusual, and this has got nothing to do with me downplaying my colleagues who I know are working very hard, but it's about the fact that we need to appreciate and understand that we're humans and sometimes we can make mistakes. But unfortunately, in our line of job, the mistakes might not be somebody's health or somebody's life. And so there's something we do, we think about our thinking. And when you're inundated with so much work, you don't have that luxury of thinking about your thinking. And that might just be one person. We might see it as numbers, but that is one person with significant family and significant others. So if I would say something is, if that thought at the back of your mind is, and you think that you're not getting the right answers, pick yourself up to the hospital and get checked out. Before I became an elderly care trainee, I was in oncology, in cancer medicine, and there have been untold cases of people who have, yourself better than anybody else, who know there's something not right here, but not getting the right answers, and 6 months down the line, they picked up a cancer somewhere.
Doc, thanks for that. It's really, really important, because sometimes we do have delayed presentation in our community, but like you've rightfully stated, it's because of how we've been treated and those poor experiences that have meant people don't want to engage with services and feel they will not be listened to, and therefore they stay at home. So you've heard clearly from Doc this afternoon. Please, the whole lessons of these sessions are to empower you, but also to make sure it results in improved health outcome for you and your family, your friends, and your loved ones. So you can always find a way around it. Your GP is not the only point of call, like Doc mentioned. Pitch up at A&E, but also we do have an advocacy service, and we have partners on this call here, 2 organizations down in London, Leeds, Birmingham, Sheffield, and I'm sure through that network, wherever you're living in any part of the UK, then you could get some advice in terms of what you do. So for the person who's talked about not being able to get annual health check around your birthday since the pandemic, Doctor is hit the nail on the head. That is difficult times and there are pressures in the system. But by all means, yourself better than that. If you have an underlying health condition, then you ought to be more vigilant compared to, if everything is all right and you just want to know. But other than that, if there's anything you're concerned about, yes, you can try 111. If it doesn't work, turn up at A&E. I think current waiting times may be anything 8 hours to 12 hours, but it will be well worth it because your mental well-being is important. So a comment from Dr. Vicky. Sometimes doctors and patients don't understand the same thing. You might ask for kidney and liver screen, and they think it's the whole range of special tests for all kinds of kidney and liver diseases. In that case, it's unfortunate. Very likely they will turn the request down. So unless there's already something showing on the usual routine tests for kidney and liver, they will find a way around to turn the request down. So this is coming from, a doctor who works in the system. And I think the health literacy, which you will gain through these sessions is really, really important. So you can have those conversations. And I think earlier on, Dr. Valentine was talking about how you you say the same things in different way, to get the, approach you need or the results and the outcomes. So Doc, it's been great having you, really insightful, calm, lots of experience. You've touched on the cancers and others, but also, your new specialty and the passion and a broad range of advice. So before we let you go and we listen to announcements for upcoming events, then we will be asking you to share 3, top tips, take-home messages with us. But for all those who live in, Greater Manchester or, Greater Manchester is within your reach, next Saturday, we having, health fair after the health hour. And it's just an opportunity, whether you're interested in health and well-being jobs, or you want to be screened because, it's been a while. I mean, our own volunteer Black nurses will do the screening. They're well-trained, registered. They'll have conversations with you. And, there will be some volunteer doctors on site if you want to have second opinion. Second opinion is really, really important. So I'll hand over to Dr. Valentine to, give us some take-home messages, and then we will take some announcements. But could you thanks for, highlighting e-consult service, which is available now. Once again, you just have to make sure you have access to your, IT equipment, and then within 48 hours, someone will contact you. Doc, whilst you give your closing tips, I think it's really important for our community. For some of us, when we're growing up back in Africa, it was said, if you want to hide anything from a Black person, put it in a book. So we have to be vigilant. We've got to utilize and appreciate. And that is why we will encourage all of you, please spread the word about these Saturday morning sessions. The joining links, the meeting IDs are the same. The more we hear from people like Dr. Ngwa from our community who understands our food, our culture, our upbringing, the challenges we face on the day-to-day, week-to-week basis, the more we become resilient. And then I like that word, resilient, positive aging. So Dr. Ngwa, over to you for 3 take-home messages. Thank you.
Yeah, thank you very much. I think as we grow old, as we age, no matter what age that we are at the moment, being teenagers, being young people, being adults, we should realize that we can see aging in 2 different ways. The negative connotation, which we can emphasize the vulnerability and the downside, but we could also see the potential to age better. And that is what we need to be emphasizing on, the second part, the potential to age better. And no matter what part we are in at the rung of the ladder, there's always the opportunity to do better, to carry on. Like as I said before, if you can't run, walk. If you can't walk, crawl. But we just need to keep moving. And I'll never emphasize this more by saying again that strengthening our community, developing community resilience is a sure way of ensuring a personal resilience as well. So coming on and giving ourselves and our time to our community programs like this should be something which we should do and volunteer. And it has been shown that volunteering actually increases our life expectancy. So I'm sure we should all do that and get a dummy whammy, life expectancy and strong community cohesion. But thank you very much for having me. I've been blessed.
Dr. Valentine Ngwa, massive thanks once again for your time, and for all colleagues from the Cameroonian Doctors Association who have joined us this morning and afternoon. We look forward to having some of you share on your different specialties as well, because together as a community, we are stronger than being divided. And I'm going to hand over to a colleague at CAHN now, Daniel, who is a finance manager, but he has a couple of interesting, events coming up that he's going to touch on. And then don't forget, there is a session with, later on this afternoon with the Home Office. It's all about Windrush. Once again, I know for many of us, when we hear the Home Office, it sends negativity down, but they have a dual role, to protect and to make sure people are safe. So therefore, we invite you to come on, engage with them, non-advised basis. Nobody will take your details. No enforcement will follow. But for now, Dr. Ngwa, massive thanks. And we look forward to having you back again soon.
Anytime.
Over to you, Daniel.
Thank you.
All right, thanks, Charles. Massive thanks to Dr. Valentine for this informative session on positive aging and wellness. Doctor, we really appreciate you for sharing your wealth of knowledge with us. Thanks so much for coming. And a massive thanks to our wonderful chair, who is also our Chief Officer, Charles, for hosting this session in such a brilliant manner. Charles, we appreciate you. Big thank you to all our CATHIP partners and to all our attendees on Zoom, Facebook, and YouTube. And if you really want to access Dr. Valentine's slides for today's session, please email health@cahn.org.uk. All right, so we have some upcoming, exciting upcoming events for you. Please stick with us. Slides, please. Comms. All right. I think I have to go ahead of the comms. Okay, so we are back again next Saturday for our CATHIP Help Hour session. Same time, same link, and the topic is dealing with panic attacks and generalized anxiety disorder. The guest speaker is going to be Dr. Joseph Omofoma, a known face on this platform, and the time is, as I said, from 11 to 12:15. All right, next slide, please. Join us next Tuesday for our Healthy Heart session, and the topic is going to be addressing socio-cultural influences on diet. The guest speaker is going to be Dr. Hiba Osei-Kwesi, a registered nutritionist. Next slide. Please donate to help CAHN make a difference. We want to increase our capacity to help those who are in need of our services, and these are services related to advocacy and domestic violence and sexual abuse services. So please do donate. If you want to make donation, please visit the link that will be shared by my colleagues. That's www.crowdfunder.co.uk/p/keep on top -or-with -CAHN -advocacy service. Next slide, please. So CAHN is collaborating with Action Funder to bring you a Meet the Funder event, which will provide key information about how to access funding for your organization using the Action Funder platform. And this meeting will be held on Zoom anyway. And if you really want to register for this event, please email events@cahn.org.uk. The time is 12:30 p.m. Next slide. CAHN invites you to a health and well-being fair, and the date is on Saturday, 28th January 2023. At the time is 11 to 6 p.m. The venue is going to be Victory Outreach, Manchester. To register for this event, please email event@cahn.org.uk. Next slide, please. So CAHN, in collaboration with the Home Office, is having a drop-in session today. That is from 1 to 4 p.m. today. The topic is Windrush. It's going to be on Zoom. So to register for this event as well, please email advocacy@cahn.org.uk. Next slide. And then CAHN offers family and advocacy support services, that's our counseling services. Please, if you need any sort of support, please do call 07710 022382. The number again is 07710 022382. or email help@CAHN.org.uk. Next slide, please. Okay, so if you live within these regions, please get in touch with our wonderful CATHIP partners. That's Caribbean and African Health Network. Next slide. RAFA International Development Agency. Next slide. Black Health Initiative, which is BHI. Next slide, please. And then Croydon BME Forum. Next slide. Enfield Caribbean Association. Next slide. And then lastly, the Royal Assembly Redeemed Christian Church of God. Thanks everyone for joining today, and have a lovely, lovely weekend. Over to you, Combs.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Outlook. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@CAHN.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.